Senator Henkel. Hello, Madam Minister. Welcome for being here and for supporting S-243, the annual report on the Canada Health Act that you tabled in February provides us with a useful and transparent picture of the state of our system. In particular, this report indicates that the federal government withheld more than $62 million in health transfers from the provinces because patients were charged for care that was supposed to be covered by the public system. Despite these penalties, these situations persist year after year. Minister, beyond these financial penalties, have you considered other measures to prevent these practices and ensure that patients do not have to pay for care to which they are entitled? Minister. Thank you for the question, Senator. Do you know that those penalties haven't always existed, so they are a first step? For the time being, I do not intend to otherwise penalize the provinces. Instead, I'm trying to understand why they are persisting in this practice. And I tell them they have to stay within the Canada Health Act. Of course, some people think that services should be privatized. For the time being, I'm the guardian of the Canada Health Act. This is what Canadians have chosen. And I think that's why I'm working with provinces and territories closely and tell them, look, you can work within the law, but as soon as you go outside of what's in the Act, I have to set controls because I am representing Canadians in healthcare, federal healthcare. We must adapt healthcare services. It's not necessarily a problem of funding. It's in the delivery of services that we have a problem. Senator Henkel. Thank you, Madam Speaker. Minister, on the same topic, some provinces, such as New Brunswick and Nova Scotia, have succeeded in eliminating these patient charges and fully recovering the amounts deducted thanks to concrete action plans. Do you intend to make this issue one of your priorities in order to support these successes and replicate them across the country? Minister. Thank you for the question, Madam Minister, Madam Senator. I can tell you at the last FPT meeting, federal, province, and territorial meeting with my counterparts, the last in-person meeting, that is, because we read regularly online, we decided that the federal government would share best practices with other provinces, and this has already begun. When a province succeeds well in an area, and this is what the provinces have requested, the other provinces don't want to reinvent the wheel. They'd like to simply base their own changes on success stories elsewhere. And I think there are even agreements, direct agreements. Thank you, Madam Minister.